Welcome back to those of you that have just tuned in. You're listening to Warehouse Christian Radio, and this is Beauty for Ashes with Kirshni Peramal. So, for the health and wellness slot today, I have decided to discuss change in season illnesses. And with spring here, many of us, including myself, can't just enjoy sniffing a flower due to hay fever or sinus issues that we have. So, to discuss this with me, I'm joined today by the lovely and exceptional Dr. Vion Longmore, or Dr. V, as many of us fondly know her. Welcome, Dr. V, and thank you for making time to join us here today.
Cool, it's such a privilege. Thanks for having me.
You're welcome. We're more excited to have you here with us. So let's get right to the crux of things, okay? And talk about hay fever and allergies. Why do you think some people get these illnesses?
Kirshni, so the first thing to know is that hay fever is not an illness. Although you may feel sick, it's not a sickness. It's basically just your body that doesn't turn off the attack signal when it picks up an allergen. So we all will get exposed to the same thing and we all release our body's fighting capacity, but then we will taper it down when we realize that the job is done. And for some people, that doesn't happen. So they just produce more and more fighting capacity against an allergen. And that's then when it's in hyperdrive and you get the symptoms that you have. And that may be genetic. So some families have it in the family, or you may be the only unlucky one in your family. And obviously certain triggers will set you off or not.
Okay. And how do these differ between children and between adults?
So your very early kiddies, so I'm talking preschoolers, they tend to have recurrent sinus and ear infections. Your tiny babies will snore or sleep very poorly. And so for moms of newbies, the baby that's waking every 45 minutes, that's your allergy kiddie to look for. Obviously, there's a whole bunch of other stuff, but that's one of the things we'd look at. And so kids tend to go straight to a sinus and a constant cough, usually at night. Obviously, they can get the runny eyes and itches, whereas adults tend to get more of the runny eyes, sneezing, runny nose. But that's also the category where snorers come in. So people who snore, then they're very tired in the morning, then they tend to eat poorly, gain weight, fall asleep in front of the TV. And a lot of those people have undiagnosed allergies.
Yes, you've actually listed some of the consequences, for these allergies. Is there any more that you can elaborate on for these untreated allergies?
So, there's different, so allergies doesn't necessarily only affect your respiratory system. So your respiratory system is the part that you breathe with. So anything from your nose down to your lungs, and obviously the nose would be runny, blocked, congested. Your nose is linked to your eye, so there's a little duct between the nose and the eye, and your nose is linked to the ear. So ear issues, ringing in the ear, blocked ears, runny eyes, then your postnasal drip, and then obviously asthma. But another allergic condition is often the skin conditions. And a huge component to conditions such as eczema and psoriasis, although not exclusively, is an allergy component. So when you're trying to control these things for people, you've got to look at allergens and how your body is potentially responding or over-responding to these.
And what about our kiddies? What are the consequences of untreated allergies in them?
From a very personal perspective, so our son has allergic rhinitis, which is a big fancy word for just chronic runny nose.
Yes.
But his nose run out the front. So he's not the snotty kid that walks around at school. It constantly runs backwards. And so when he was very little, he was that very poor sleeper. So initially he would wake every 45 minutes as a baby. And then a little bit later on, obviously he got his first ear infection, and that led to another, and sinus and all of that. And then we noticed a hearing delay. And with him because it, you know, we were trying to get it under control, but we weren't winning, fluid was building up in his ear. Because like I said, there's a little nose, there's a tube that builds between the back of the nose and the ear. And when that's not equalizing, and that's the one that you also, when you on the aeroplane and you pop your nose and you pop both ears, those are your equalizing tubes. When they're not working properly, you suck fluid into your ear, and then it's like you are underwater trying to listen to someone. So if you lie in the bath or in the swimming pool and you have a conversation, you lose certain sounds. And so for kids, when they're developing, they're not going to hear mommy's high-pitched squeaking, moaning at him, because he can't hear that decibel. Yeah. So they have hearing loss. You can correct it. And because of that, their speech gets delayed. So they don't have the confidence to have such a large vocabulary, and then their pronunciation gets affected. And that's obviously your upper ones. For the lower kiddies, the ones who tend to be more lungs and asthma, they have recurrent chest infections, and that affects their ability to play, to run, to partake of things. So they tend to not want to, because they get short of breath, and then their physical and motor development gets affected later on.
Okay, so let's say we have patients with allergic rhinitis and sinusitis. What would be the best possible treatment that you could recommend over the counter? If people are maybe too scared to visit their GPs, you know, they just want to quickly go to the pharmacy during this time, what would you recommend? Or is there stuff out there?
Definitely. And that's the joy in South Africa, is so much is available over the counter, and for good reason. So the first thing is getting buy-in from both parents and adults for themselves to take medication for something that's not an illness. So when we don't feel well, or our child is not sick, we are hesitant to give medication, and for good reason. But if you take the fact that this is a chronic condition, and the better that you control it, the less the long-term side effects, and you basically take the medication that you require every day, even on a good day, and that's the hard part, yes, you get much better control. So there's two forms for allergic rhinitis. The first is an inhaled, which is through the nose, little puffy spray of a low-dose cortisone. And you get various formulations for kiddies under 12 and adults over 12, but that's available over the counter from the pharmacy. It's about 100 Rand, and that bottle will last you 2 months. And then the second component, which forms part of every single allergic condition, whether we're treating the nose, the skin, or the chest, is an antihistamine. There are various forms. The most commonly known is Allergex, and they fortunately have recently brought out a non-drowsy, which means that you don't feel tired after taking your morning dose. Now, Allergex is a twice daily dose, so it's morning and night, which makes it a little bit more difficult to remember. And next, over the counter again, Schedule 1 is something like Texa. Now, Texa is non-sedating. It's often on special at the big pharmacies, and that gives you an all-day cover. So whether you take it in the morning or at night, syrup or tablet form, that massively helps you to control it. From there on, that's pretty much as you have available over the counter. So then for your skin conditions, there's a whole bunch of over-the-counter allergy creams and antihistamines and cortisone creams. And our pharmacists in this country are so knowledgeable that you really can describe your symptoms to them, and they will give you an assortment of options that suits your price and budget and preference to treat a lot of these conditions. And as long as you give it long enough, so 2 to 3 weeks before you give up, you should get control for 80% of people. And the rest will, obviously, they need to see a doctor.
Yeah, that's my next question, V. So let's say I've tried everything over the counter. When do I need to see my doctor?
That's exactly it, is when you've gone 2 weeks, or you're getting severe symptoms where it's affecting your ability to breathe, and you've tried over-the-counter medication, because often what we prescribe is over-the-counter.
Yes.
So to save you time and money, start there. And if after 2 weeks or with severe symptoms, you really are not winning, then come see your local GP or whoever, and we'll start you on a journey to figuring out exactly what you may be struggling with.
Yes. Are there any vaccines that you would recommend people can go out and take during this time?
Yeah, so with Corona, obviously, and unfortunately, we didn't get too many influenza that were used up overseas, but an annual flu vaccine boosts your immune system massively to allergens. And then there are specific allergy, they're not vaccinations per se, but they are immune boosting injections that we can use for very severely allergic people who struggle during this time. And your doctor will be able to chat to you. But you've got to go back to the original question of, or discussion, that having allergies is not an illness. You are not sick. You feel sick, but you are not sick. Your body is not compromised. So you don't need vaccination for allergies. You just need the right immune training for your body to respond appropriately to an allergen. And those become available in an injectable form for some people.
That's perfect. So if people would like to get in contact with you, V, if they would like to maybe book an appointment to come and see you, how do they go about doing this?
So I work as part of a group practice. There's 3 GPs. And what's nice is we are quite familiar with exactly this of remote video consultations on various platforms. Obviously, we do the old school, see your GP kind of visit in the rooms as well. And we are at Scottborough Family Clinic. So if you Google us, Scottborough Family Clinic, on Facebook, Instagram, you'll find all of our details there. And you can, on our website, scottboroughfamilyclinic.co.za, there's a little write-up on each of the doctors, what our particular interests are. There's pictures so you can see who you're getting in, getting into with a consultation with. And then we just basically go from there. We do WhatsApp consultations as well as Zoom platforms, and then in the rooms as well, in Scottborough, which is on the South Coast.
So there you have it, guys. It's the Scottborough Family Clinic. And Dr. V, I'd like to thank you for taking time off your busy schedule. I know how hectic things are during this time. So we really appreciate you taking this time off to chat to us about something so important and something that's here already. And we wish you well at the Scottborough Family Clinic.
Thank you very much. Thanks for having me on your show. And I hope you have lots of listeners for all the shows to come.